Alrighty, so we all just first off want to say thanks to PM&R Scholars for putting on the virtual residency fair. I think it's a great idea to get exposure. So we are the Sinai Hospital of Baltimore PM&R residency program. We take 4 residents a year. We have 12 residents, obviously starting PGY 2 year. Each class is 4 people. Sinai is a 480 bed acute care hospital, and within it on the 5th floor we have our rehab hospital, which is a 43 bed hospital. It consists of a locked TBI unit, a stroke unit, and a general rehab unit. Before going any further, kind of want to just introduce myself and then other residents that are on with us. So my name is Eric Munyo. I'm a PGY 3. I'm the junior chief resident. And if we want to go through my other co-residents that are here. Christine?
I'm Christine. I'm one of the PGY 4s and one of the chiefs.
Hey guys, I'm Errol Judge. I'm one of the PGY 3s. I'm sort of the unofficial social and technology chair. So if you reach out to us through Instagram, I'm your guy.
Hey, I'm Yash. I'm one of the PGY 4s and the other chief.
Cool. Alrighty, so before we go any further, we actually have a little video we put together for you guys to watch.
The Sinai program is a really special residency program because we spend so much time getting to know our residents. I get to know every single one of the residents. I feel personally connected to each one of them, and I think that's what makes this special.
Being new in the residency program here, I've always felt very comfortable. Everybody's very kind. Everybody kind of vibes together. We have a great program director and a good role model to look up to.
It's really a family atmosphere. We work as a group. Both the faculty and the residents work together to make sure that it's always one-on-one. We also have a structured didactic program that is really geared towards preparation for the board examination.
We take charge of our own board review, and so we prepare the lectures ourselves and give lectures to each other to help with their own board review.
We usually have a guest lecturer, either one of our attendings or somebody from another facility, come and give us sort of their expert lecture on things.
We work extremely hard to maintain a balance between service and learning at our program.
Every day we're taking care of patients, and that allows us to hone our service skills and work on our relationships with taking care of patients. But at the same time, we're working with the attendings and the staff, and we're definitely learning a lot from them in terms of each patient's care and using that as an educational opportunity to teach us.
We also do things that sort of break up the monotony of a normal didactic section. So we'll go on basically a little field trip. And we've done things like adaptive sailing in the Inner Harbor, where they show us how they do the sailing for the people that come through the program.
Anytime there's downtime, we're always joking around with each other. It's a great camaraderie. Our program is very accommodating to basically fit your needs.
So being a resident here, I feel like I've been able to sort of learn how to have my normal life that I had before medicine, yet still focus on what I need to do for residency. My wife and I just recently had a baby, and some days I'm able to go home a little early to spend some time with her after work, and it's really something that I'm happy I'm able to do in residency.
If you feel like, okay, this could be the place for me, definitely feel free to reach out to us and apply to our residency program.
Awesome. So thanks for paying attention there. So currently we have 2 program directors. Dr. Melanie Brown is our program director, and she's been our program director for the past 15 years. And our associate program director is Dr. Miriam Karamati. She will be taking over as program director starting next year. Dr. Brown is also our inpatient TBI attending, and Dr. Karamati is our one of our outpatient TBI and spinal cord injury attendings. Just a quick brief overview of the program. So in total, the 3 years, we do 1.5 years of inpatient rehab and 1.5 years of outpatient rehab. Really the goal of the program is to come out after 3 years as a great, well-rounded physiatrist. Our schedules are broken up into 3-month blocks, which I personally really like. We start 1 rotation and kind of gives you a chance to get some of the clerical and EMR type work under your belt, and then after you get the day-to-day stuff down pat, you can really focus on educational and patient care and working with the attending. Brief overview of our 3 years here. So starting with PGY 2 year, you do we do a general inpatient block. This is occur. There's just is most just general patients. We also have a lot of post-CABG patients that come in. We also have a program within the general rehab that is called Function Plus, which takes chronic pain patients who are opioid dependent. We work to wean down their opioid requirement as well as giving them some intense inpatient rehab. We have our neuro block of 3 months of PGY 2 year, which is mostly stroke. And then we have an ortho block during PGY 2 year, which takes patients after that have had mostly total joint replacements or had fractures. And then finally, PGY 2 year, you have 3 months of outpatient, which consists of a P&O clinic. It's a multidisciplinary clinic with the chief of the department, so you get really good exposure to P&O there. We also have a spasticity and Botox clinic and some pain management sprinkled into that, all during your PGY 2 year. I'll throw it over to Christine for PGY 3 year.
Yep, so PGY 3, it's more outpatient based. So we have a combination of a sports medicine, EMG, some consults, a little mix there. And then we spend 3 months at the Baltimore VA, so we get to interact with the veteran population. And that's a whole mix of outpatient clinics, from sports med to pain management to spinal cord injury, and amputee clinic and wheelchair clinic. And then we also, the other outpatient rotation is back at Sinai, and we do outpatient TBI and spinal cord injury. And then the one inpatient block that we have PGY 3 year is our spinal cord injury block, which is at University of Maryland Rehab and Ortho Institute. And then I think Yash can speak on PGY 4.
Sure. So one of the rotations we do is our interventional pain rotation. So obviously a lot of interventional pain procedures, and then we do a ton of ultrasound guided procedures as well. So it's not just the fluoro suite, but there's a ton of ultrasound as well. And then we do 3 months of inpatient TBI, 3 months of EMG and nerve conduction studies. So we usually go way past our numbers in terms of the numbers needed to graduate. And then we do 3 months of a combination of inpatient and outpatient peds. And we actually do that in conjunction with Hopkins. So the Hopkins Pediatrics Hospital is where we rotate. So that's kind of cool.
Cool. All right, moving on. So banking off that a little bit. So our training sites, most of them are in the greater Baltimore area. Sinai is the big star where the cursor is right here. Actually, we also train at the University of Maryland, which is over in this area. And then a lot of our outpatient offices are just scattered throughout Baltimore. Kennedy Krieger and Mount Washington Pediatric Hospitals, Yash said, those are our pediatric hospitals affiliated with Johns Hopkins. And then our one rotation we have to travel for is the Walter Reed EMG rotation. It's a bit of a commute, but consistently our residents say it's worth it, and the EMG experience you get at Walter Reed is worth any commute. So we've been really happy with that rotation. As far as where we all live, a lot of residents live in Baltimore City area. Some people live in Towson as well. There's a University of Towson, so a lot of apartment options there. And then some of our residents also live in the suburbs out west a little bit. And one of our residents makes the trek all the way from west in Frederick. It's about an hour, but he's still able to make it to things on time. So traffic is pretty manageable around the city. Our didactics are every Wednesday morning from 8 to noon. They're 4 hours, all protected time. And we do a mix of attending and guest lectures, as well as resident-led board review sessions. And the way we do our board review is we basically cut up Cucarillo and we divide it amongst the year so that we cover the whole book within 1 year. And along with that, we do associated questions, like 20 questions per week on the topic. We also have ultrasound EMG hands-on things throughout the year. We do mock oral presentations, usually like once a month. And then just recently this year, we started an ultrasound club, which is all extracurricular, but to increase our exposure to ultrasound. As far as vacation, we get 20 PTO days. Nice thing about our program is they do let us just take one at a time. So if you need to take a Friday off for a wedding or whatever you have, usually our program's pretty receptive to doing that. And our call is all in-house call. Usually it's pretty quiet, so you get to sleep. And then the nice thing about having in-house call is you do get that post-call day off. gives you time to run errands and get things done. And then our general call schedule is all tapered. So PGY 2-year, you have around 51 calls. PGY 3-year is about 26-ish calls. And PGY 3, you do no Fridays, Saturdays, or holidays. And then PGY 4, there is no call. So GME provides to us our PGY 2-year, you get a $300 electronic fund. They also reimburse step 3 for you fully, and they also give us money to go to conferences, both AAP, PM&R, or whichever conference every year. And then in the beginning of PGY 2-year, we are given Cucarillo, the board review book, and then the Bradham PM&R book, both of no cost to us. Unfortunately, we can't moonlight. That's just a hospital-wide Sinai policy, so no opportunities there. A lot of our residents every year go to AAP and AAP&R. I know this year is going to be virtual, so it'll be a little different. But like you said, the GME office reimburses us for going to these conferences, and we also get days each year to go to these conferences that are on top of the normal vacation time. We do a lot of wellness in our didactic sessions. Do things from just hikes to different yoga, stretching. Do a lot of get-togethers. We go on a field trip usually like every 5th Wednesday. We try to do a community outreach program. I think we've done things like wheelchair basketball, hippotherapy. We've done adaptive sailing in the Inner Harbor, so a lot of fun things. So basically, everyone at our program's really happy. The residents have a great balance between having a good lifestyle as well as getting a really good PM&R training. I think our faculty are all very receptive and open to new ideas, and they're flexible to anything we bring up. So it's our Instagram here if you want to follow us. And then this is our email if you'd like to contact us with any questions. And if there's any questions right now, we'd be happy to field them. Let's see if we can. Any questions?
All right, so there's one on the
Oh, yeah.
chat, or a couple. So what are the reasons that we all rank Sinai and any challenges that we face? So personally for me, it might not apply for everyone else, but I actually grew up in Maryland and families here and whatnot. So actually, I'm not renting anything. I own a house, paying mortgage and whatnot. So being in the Baltimore region was a high priority for me. And Sinai was one of the programs that just has a really great vibe, super supportive staff, and it everyone, all the attendings, they're focused on resident learning, and that was a big thing for me. So one, being local, and two, just that focus on resident learning and not just having us as cheap labor. That was great.
Yeah.
Opportunities for elective months, we get a good amount. So every year we get 1 to 2 months of elective months, and you can do basically whatever you want. So if you can do research, get extra opportunity for pain, do kind of an away, or if you're interested in fellowship and another program. So we have a good amount of opportunities for that. Ultrasound, I think we kind of covered, but there's about
anatomy. So before COVID, we were going to the anatomy lab usually every year. We haven't been able to this year, but usually go to the anatomy lab at University of Maryland.
And then ultrasound, we get a good amount of exposure. I'm on that rotation right now, and it's every day I'm scanning a couple people and injecting ultrasound guided and stuff. So you get a lot of good bread and butter experience. Cost of living, I would say for Baltimore, it's about equal to other big cities. So I'm actually from Chicago, and I've lived in a couple other cities. So relative, I would say if you guys are looking, averages are $1,700 for a 1-bedroom, 2,000 to $2,150 for a 2-bedroom. So pretty reasonable. And then even around Sinai, there's a couple areas outside of the city itself that are a little bit more affordable.
You guys have 5 minutes left.
Thank you.
Thanks.
What do the residents do? We teach others. Well, do you want to answer? What do the residents do outside of the hospital?
Yeah, so before, every year we kind of had a little get together at the beginning of the year. That's been a little limited this year. We've been able to go on a few hikes together this year, socially distant, of course, but usually, there's the downtown Baltimore area is a lot of fun, a lot of good restaurants, the National Aquarium's down here as well. So a lot of things to do in the off time.
Last year when they were having it, we had a little volleyball intramural team with Hopkins. I know Errol was part of it. I wasn't able to make any of those games, but that was fun.
I can take, so I can combine the electives and then the surprising thing about our program. So I think Christine mentioned just lifestyle balance and ease of openness of our program was one thing that drew me. But coming here, I just didn't really, I guess, grasp how really understanding and open. They really want us to thrive in whatever environment is best for us. So there's a structure, but electives, like I said, there isn't really anything under the PM&R sun that if you don't want to do, we will not try to make that happen for you, obviously, if it's reasonable. And so that's one thing that surprised me in terms of how the program director and the attendings kind of go out of the way to foster that learning environment to what your specific needs and wants are.
Kind of another example on top of Yash's. So one of the PGY2s this year was really interested in maybe getting a butterfly or more of a mobile ultrasound. So he kind of wrote up a proposal for that, proposed it to our program director and the chief of the department, and it looks like pretty positive for us getting one. So they're very open and flexible with our educational wants and needs. So it's a very supportive program.
In terms of evaluations, we do them biannually. So every 6 months we have evaluations. Every quarter when you finish a rotation, your attendings write evaluations and they're always evaluating you. But with the program director, formal evaluations are twice a year. In terms of the video, I'm not the most tech savvy, so I don't have a link off the top of my head, but if you email us, I think Michael said that, go ahead and email us and we can definitely get you that video. We don't mind, and you can share it to everyone else. One thing about the surprise as well is until starting intern year and residency, I didn't realize, so I have a couple brother-in-laws and other people in medicine, we are, out of everyone I know, we're one of the only programs that really is flexible about PTO in terms of you can take 1 day at a time or things like that. Most places I know have to take 1 or 2 weeks at a time. And
you guys have 2 minutes?
You request it. And so I think that's a big surprise of us. It kind of really just lets you be flexible in terms of planning things with your friends and family.
The outreach activities, so those are our, we call them the fifth Wednesday. So every fifth Wednesday, we do some sort of field trip type activity. Last year, we went to a company that makes all sorts of adaptive rehab equipment. In the past, we've done adaptive sailing, hippotherapy. We've done, last year, we also went and played wheelchair basketball, just different things to kind of get exposure to rehab in the community.
Guys, just another thing I wanted to add to being in this, in the Baltimore area, there's a lot of other facilities that are well known. Someone mentioned Hopkins. We do actually work closely with them, and I'm actually going to cover a bike race with them. And I know MedStar, somebody also did research for. So there's a lot of different facilities. If you're looking for opportunities, they're definitely around in this area.
One thing our program directors tell us, and actually a lot of people on the interview trail, is that we are a community hospital, but we have access to all of the academic hospitals in Baltimore. And so since we have such close relationships with everyone, the sky's the limit in terms of anything that you want to do.
And then a quick shout out, I know people are always interested in sports and pain. So our sports rotation, we work with the team doctor for the Baltimore Ravens. And so if you guys are interested in sports, that's a huge opportunity that you'll have. And then if you're interested in pain, I myself have gotten to do rotations at Hopkins for pain at both of their pain programs. And without a doubt, I know that if I wasn't at Sinai in Baltimore, I may not have had the opportunity, obviously outside of Hopkins. So like these guys keep saying, Hopkins, University of Maryland are pretty big names as well in the academic and medical field. So